Your meeting is now live.
Thank you very much. Good afternoon, everybody. Welcome to the Portsmouth NHS CCG Public Governing Board meeting, which is being held and streamed via Teams. And on today, Wednesday, the 17th of March, it's just after 1 o'clock. I need to indicate when you are ready. I need to inform you that I'm Andy Sylvester and I'll be chairing the meeting this afternoon. And I'm doing that as Dr. Elizabeth Fellows has today sent her apologies. We're meeting virtually in response to the limitations placed on governance by the COVID-19 pandemic. Members of the public have been invited to view this meeting via a link available from the CCG website. And papers for the meeting are also available via the same website. Today's meeting is being recorded so that in the event of a failure of technology, it can continue and will then be uploaded onto the CCG website as soon as possible. Bookmarks have been added to the pack of papers in order to identify agenda items. Board members are requested to keep their microphones on mute and to only turn these on when they are called to speak. Please only use the chat function to indicate that you wish to speak and do not use for questions or answers, because this is a meeting in public and the public won't be able to see the chat function. I would therefore firstly like to welcome Joe York, who is attending as Ines Richings' deputy today. Can I please ask everybody taking part to confirm that they are present? So I will call your name if you can just confirm you're here and you have good communications. So starting first with Helen Atkinson.
Thank you. I'm here, Chair.
Thank you. Can you give your role as well, Helen, and everybody else, just as we know who you are and what you represent?
Yes, because I'm the Helen Atkinson, the Director of Public Health for Portsmouth.
Thank you. Karen Atkinson.
Yeah, hi, Karen Atkinson, Governing Board Nurse for Portsmouth CCG.
Thank you. Dr. Linda Colley.
I'm present. I'm Chief Clinical Officer and Clinical Leader.
Thank you. Margaret Geary.
Yes, here. I'm a lay member of Portsmouth CCG.
Thank you. Alison Jeffrey.
Alison Jeffrey, Director of Children's Services for the City Council.
Dr. Carsten Leschardt.
Good afternoon. My name is Carsten Leschardt. I'm a GP in Portsmouth and I'm one of the clinical executives with Portsmouth CCG.
Thank you. Graham Love.
Good afternoon. Yeah, I'm Graham Love. I'm a lay member.
Thank you. Jackie Powell.
Hello, Jackie Powell, lay member for Portsmouth CCG.
Thank you. David Scarborough.
Good afternoon. Yes, David Scarborough. I'm the CCG's practice manager representative.
Thank you. Dr. Simon Simonian.
I'm Simon Simonian. I'm a GP at one of the clinical execs.
Thank you. Michelle Spanley.
Hello, I'm Michelle Spanley. I'm the Chief Finance Officer for Portsmouth CCG.
Thank you. Dr. Tawinda Upile. Okay, you may get into the meeting later on. And David Williams.
Hello, I'm David Williams. I'm Chief Executive of Portsmouth City Council.
Thank you all very much. As I say, I'm Andy Sylvester. I'm a lay member and deputy chair. Okay, so we'll firstly start with the item number 1, which is apologies for absence and welcome. So we have received apologies from Ines Richings, Dr. Nick Moore and Dr. Elizabeth Fellows. Item 2 is the register and declarations of interest. This is an opportunity for anyone to declare any conflicts of interest that they have in relation to the items on the agenda this afternoon. So if you could use the hand function if you wish to make any comment. That's good. I'll take there's no conflicts of interest. Item 3 is minutes and actions of the previous meeting held on Wednesday, the 20th of January 21. So I hope you have sight of those minutes. I'll take them page by page for accuracy, correctness and comment. So page 1, page 2, page 3, anything from the minutes? There's no indications. Okay. If there's no comments on the minutes, then can we agree those as a correct set of minutes from the previous meeting?
Yeah.
Lots of nods and a yes. Thank you very much.
Sorry,
Graham's got his
Andy.
hand up.
Oh, excuse me. Sorry, Graham. Yes, please.
Sorry, it's just a couple minor things, Andy.
Yep.
On page 5, about halfway down, it talks about something Alison was saying. I think it's just a typo. We need to insert the word to, so it reads "would like to thank."
Right.
And then just on page 7, it refers to a question I asked where I think it uses the phrase "no deal Brexit" when, of course, there is a dealed Brexit. So I think the "no deal" probably just needs to come out of that phrase.
Thank you, Graham. Yeah.
Thank you.
Yeah. Okay. Right. With those amendments, we agree the minutes of the meeting.
Yes.
Thank you. That now takes us on to 3B, to note the summary of actions. As you can see, the table in front of you with 5 agenda items on there. So the first one was 3A, the minutes of the previous meeting, quality and safeguard report. This was for Karen to action.
Yeah, as it says, I've had confirmation that there is now a SOP for mental health patients going into ED or contacting 111 first.
Good, thank you, Karen. Item 4 was the Chief Clinical Officer's report, so consider including case studies or patient stories for future meetings. There's an action on the Chair and Justina, and that will be considered for future meetings. Again, item 4, same report, circulate proposed timelines of planning priority setting. From Michelle, we have that included in the March Governing Board papers. Thank you, Michelle. And at 6B, performance report to provide further information regarding the reduction of 21.1% in demand for 111 service. Again, included in the March Governing Board papers from Michelle. And at item 9, the Governing Board Assurance Framework, the GBAF, the Corporate Risk Register, deep dive to be undertaken by the Audit Committee, a matter for Justina and myself. That will be undertaken by Audit Committee in due course and was discussed last week at the Audit Committee. So that's a completion of the summary of actions. Okay, so moving then on to item 4, the Chief Clinical Officer's report. Dr. Linda Colley, over to you.
Thank you. So as usual, we've brought a paper here that summarises some of the key work that's been going on. I won't go through the whole thing, but I'll just pick out some key points. So the first thing I wanted to pick out is under item 2, Quality and Safeguarding Committee update. And it's really about this proposal for transformation of the Hampshire and Isle of Wight safeguarding function. So the paper that was presented to that committee provided an outline on the progress of Hampshire and Isle of Wight, ICS and CCGs in looking at this project. And there's been a timeline established to look at how our arrangements can be delivered moving forwards, and it's just there for your information. The Primary Care Commissioning Committee met in January, and the committee at that meeting received a positive report from internal audit, which concluded that they had substantial assurance about governance, risk and contract processes used by the primary care team. Obviously, there are recommendations and they have been actioned. Also, they received a report from Healthwatch, and I think it's really important that despite what's going on, we are still having people looking into our services and making sure that we're doing things as best for public. This one was particularly looking at websites for the GP practices, and they have picked out some points that need identification and help to fix. So some of them will be linked to the actual pandemic response, and obviously the work for them will happen as soon as possible. And then there are some that perhaps can be picked up slightly later in the day, but it's really about improving communication to the patients from the practices. And so we welcome Healthwatch's report on that. The CCG Remuneration Committee, so item 4, made recommendations for extensions to the tenure of Dr. Elizabeth Fellows and David Scarborough as elected posts. We are going back out to the practices to assure that those recommendations are approved by the practice members, and we'll hopefully hear back from them shortly. In addition, we considered a workforce disability equality standard, which will be required to report against in 21-22. And the committee recommended that actually, in support of this, a disability awareness session would be arranged for us as a governing board. And we thought that would be a good topic for a future development session. So we look forward to having that in our programme over this next year. The other thing I wanted to highlight was the white paper. So the integration and innovation working together to improve health and social care for all was a paper that was released on the 11th of February 21, and it outlines proposal that is taken to Parliament to become law as a health and care bill, and it's just a list of the key proposals there. Having obviously reviewed this, this is the direction of travel we've been going on already. It is part of our natural journey, but we will look forward to working through what this means for moving forward. We have briefed the CCG staff at a team briefing, and we are providing updated information on the CCG's intranet, and as things become clearer, we intend to continue to do that. As you know, the SHIP Priorities Committee meet to regularly review policies that we can adopt across the whole patch, and the latest policy statements have been reviewed by the Clinical Advisory Group and are listed on this paper for your information. They have been recommended to be approved. And the last thing I was going to pick up on is the governance review. So as you know, we've been jointly commissioned a governance review between ourselves and NHS England, and it's coming to the conclusions around this time. We will be reviewing a draft report shortly and any recommendations and making an action plan. And I was hoping that we could propose that the Audit Committee, as our senior scrutiny committee of the CCG, are delegated to oversee this action plan once it's produced and report progress back to us as a board. So that's the thing on this paper that I'm asking for approval for. Is everyone happy with that as an approach?
Yes.
Yeah, lovely. So I've got nods. There's a question from Graham, I believe.
Margaret, question.
Is there a question from Graham?
The hand's disappeared, so maybe not.
Yeah,
Sorry. And I was just going to ask the question about the safeguarding timeline. And I know that our safeguarding boards are keen to make representations to the project managers, but was there a consultation about the timeline?
I will have to go back and find out that, Margaret. I don't know if Karen knows, as chair of the Quality and Safeguarding Committee. Was that discussed, Karen?
I'm not sure that there was. I know that we were involved to some extent, but not as fully as we'd like to have been. So I'm not so sure there has been. I know that the paper itself, Margaret, is going to the Safeguarding Adults Board in Portsmouth and the Children's Safeguarding Board. But I think we have concerns about the timeline and that it's too quick. I think so that's one of our the things we're going to raise from a Portsmouth perspective.
Yeah. It was just a genuine question about were we involved in agreeing this timeline? Yeah, doesn't sound like.
Okay, thank you.
And a question from Jackie.
Hello, mine is probably linked to Margaret's, was around the safeguarding, and that the immediate priority was to align designated professional roles, nurses and doctors. I was trying to work out, would that be one across the whole of Hampshire and Isle of Wight CCG, or what's the structure for getting the requisite number of designated professional roles? Do we know yet?
I don't think the paper. The paper isn't specific about the number of roles, although I think the team are aware. I think they're looking at more than one. I think there's quite an expansion of staff, and there's some concerns about how we'll fill those roles. So I don't think they're talking about one. I think they're talking about many, but I haven't seen the specific details.
Would that be something that's helpful to you then, Karen, from what I'm hearing? See some of the details so that we know where, because there's such important roles, where will they sit within local place or vice versa?
Like I said, from a Portsmouth perspective, we still need to tease it all out a bit, because we're not confident that we completely understand the implications for Portsmouth.
Are there opportunities to do that teasing out? If you don't mind me asking.
I do know that it's been agreed at the Hampshire and Isle of Wight Quality Board, but Portsmouth haven't agreed it. So we're hoping that if it goes to the Adult Safeguarding Board and the Children's Safeguarding Board, that we'll be able to take recommendations from them back to the lead. I think it's being led by Julia Barton on behalf of the CCGs.
Okay, thank you. So we'll get that opportunity.
And as you say, Karen, I think traditionally these roles have been quite difficult to fill. It's quite a specialist area, and so looking at how we're going to be sustainable is really important. But we do need to make sure our voice is heard in that. So welcome any feedback. I think that was everything, Chair.
Thank you, Linda. That's very helpful. Are there any other questions or comments? Okay, so are the board content to accept the clinical officer's report? Yeah, thank you. Okay. Next item then is item 5, the Health and Care Portsmouth COVID-19 update. So Helen, over to you. Thank you.
Thank you, Chair. I will just share some slides with you. Thank you. So this is the usual regular COVID-19 intelligence summary that we present at the governing board meeting. And just to say, we'll share the slides after, but also we do publish these sets of slides on a Friday on the Portsmouth City Council website as well for people. So we're going to cover a little bit on infections, hospital pressure, deaths and vaccinations. And we just show this, I know you can't read it or see it, but it just reminds people that some of the information is quite sensitive. So just for that caveat, and now I'll start with the presentation. All good news, which is great, is that we continue to see a reduction in the infection rate across Portsmouth and also across the Hampshire and Isle of Wight area and regionally, as we are seeing nationally. This just gives shows you here that we've just coming out of, as we get through March, out of the second wave, which peaked in early January. And then this shows the spark lines, and again this just splits it down to Hampshire, Isle of Wight, Portsmouth and Southampton, and you'll see there that we have had 13,985 cases totally since the beginning of the pandemic, and we have seen 129 new cases in the last 7 days. You'll see there the data for the other areas, and this nicely gives this slide gives a nice comparator. So on the left hand side you'll see the map of England, and what you'll see now is quite a lot of green and blue. I think last time I presented last month, you saw a lot of what we would see dark red and deep reds there across the whole country. But we're now seeing, which is great, the lower infection rates across the whole country, and just with some areas that are seen as having enduring transmission, which are mainly in North East, North West and some in the Midlands. But again, on the right hand side, you'll see there the comparators in terms of the rate per 100,000 in the last 7 days, and then the percentage change. Now, if I'd shown you this a week ago, you would have seen throughout very healthy reductions in terms of the percentages of about 40 to 50%. You'll see now that a few of them are slowing down, and actually even in Portsmouth, Southampton and Slough there, you'll see a slight increase. It's important to note, though, now that the numbers are much, much lower. So obviously a few weeks ago at the peak, we were seeing rates per 100,000 over 200. 200 cases per 100,000 was now we're seeing much, much less. And when you've got smaller numbers of infections, like the Isle of Wight there at 16.2 in the per 100,000 last 7 days, that any small change or an outbreak in a school or a care home really shifts that percentage change. So just to note that. But again, you'll see there Portsmouth is coming down nicely at 61.9, and we're still slightly just over the England average there, but above the southeast. But there are still areas in the country, like Bradford mentioned there as a comparator, that are still seeing fairly high levels. But I think it's important to note that we are now in the first step of the government roadmap coming out of lockdown, and schools have, as you know, returned, and we'll probably start to see this returned in the main about a week ago. We're starting to probably see that as more people come out of the stay at home message, the more people are out and mixing, we might start to see an increase in the infection. It's only to be expected as we move forward. So this is a chart, just shows you the new variants. I'll just pull out 2 points to make. So currently, nationally, I know there's a lot of media coverage about new variants, but currently, nationally, the predominant variant across all regions is still the UK variant. So again, in Portsmouth, we are seeing that of about 96.9 of cases in the last week, but it's been pretty much high in the 90s since December, and even before that. And what we know about the UK variant is that it is more transmissible. Then on the left-hand side, just to note that there are, as there have been actually since the beginning of the pandemic, you see quite a lot of variant changes. It's fairly normal in a pandemic. But the area that the variant that people are talking about a lot is the South African variant, and you'll see there's still quite a few number of cases nationally. And the cases don't seem to be increasing hugely. So only seen 8 more since the last update. And the important message, of course, is that we know that as research continues, that all of the current variants in the UK are the current vaccines being used in the vaccination programme are effective in terms of an antibody, an effective antibody response. So that's good. Then quickly going, I'll go through the age bands. You'll see here, much like the spark lines at the beginning, we continue to see a reduction, and you see there in March all of the age bands are coming down, which is really positive. One of the areas we always have concern about is the over 60s, and you'll see the red line when was up there, particularly over 80s, because that age group are more likely to end up as a hospital admission. But because we're down at such small numbers now, you're starting to see quite blips with we have outbreaks in care homes. So that's why that line went up a bit, but is now coming down again. So nicely, infection rates coming down across all age groups, and this is just showing you the younger age groups. And again, there you'll see that they've come down across all of the age bands, but we've not really had, and it's important to note, very high infection rates, particularly in the 1 to 4 or the 0 to 4 year age group. But what we tend to see is higher infection rates across the young adults and working age adults, partly because they are more likely to be out and about. And then quickly, I'll just go over the hospital pressures. So what we are now seeing is a reduction in the pressure across the Portsmouth Hospital Trust, although there are still quite reasonably high numbers of patients in the QA with COVID. So although pressure is much reducing there, you can see on the graph there are still pressures within the hospital in terms of admissions as well as patients in critical care. And then quickly, just to cover, this is an improving picture in terms of deaths. There have been 276 COVID-related deaths within 28 days of positive tests recorded in Portsmouth since the end of October, but that's reducing now, and we've only had 3 deaths in the last 7 days, giving the total 356 deaths in total. So that is an improving picture. And then just finally, just to show you some of the vaccine uptake data for Portsmouth. So again, really good news here. We are seeing across the whole of Hampshire and Isle of Wight really good uptake rates. And this just shows you obviously through the age bands and the 1 to 9 cohorts. You'll see they're all increasing in terms as each of the cohorts comes online in terms of the invites going out. We're seeing really, really good uptake overall, which is a really good news story, because what we want to see obviously is all adults that are offered the vaccination taking it up, so that we have really, really high vaccination uptake rates, because that is the way we will be able to move out of lockdown and back to any kind of new normal. So I'll leave it there. Thank you. And I will unshare slides.
Helen, thank you very much for that. Extremely useful. Questions? Linda, first off.
Sorry, I was just trying to unmute myself. I don't know whether it's for Helen or for Alison. I just wondered, with the return to schools, have we seen a good level of uptake of the lateral flow testing for the pupils? And it doesn't look like on those lines we're seeing an increase in cases in terms of asymptomatic carriage, but I just wondered how it's gone.
Alison, do you want me to start, and then you might want to join in? So yes, we've got school testing, obviously for secondary schools, that's pupils and staff, and then for primary schools it's staff, and the schools have completed the pre-school starting 3 lateral flows and now have got access to lateral flow device testing kits at home. And also the good news is that there is a community collect scheme for bubbles around family bubbles of children who have gone back to school as well, and those can be picked up at our local testing sites in Portsmouth. So good uptake on testing, and we have had small number of cases identified through the lateral flow testing, which is really why it's there and in place. And also very good news is that nurseries have already gone live in the testing, but private nurseries also will be going live on the 18th of March. So some really good news around testing opportunities there for in the school. Alison, you might want to.
Well, just to add to that, thank you, Helen. Schools have been really pleased with the high level of engagement by parents and children in testing in secondary schools. That it's over 90% in terms of the agreement to be part of this and do those regular tests. So that's as good as we could have hoped for, I think.
Chair, could we perhaps put a documented thank you to all the schools for the tremendous work they've done, as well as colleges and universities, to get the kids back at school and to do this programme, because it's no small undertaking, and we really do appreciate as a health body that they're supporting us in this.
Linda, absolutely, yes. I think the whole board will endorse that comment as well. So thank you, yes, for noting. Okay, any other questions for Helen? No? Okay, thank you very much. Right, I'll move now on to item 6, which is a verbal update from David Williams on the Health and Care Portsmouth system. Thank you, David.
Thank you, Chairman. And I know the agenda refers to an attached document. That was a draft document that we're still working on, and that has been withdrawn from publication. But what we're doing, and there's a huge amount of effort going into this, we're working very closely with our partners, both across Health and Care Portsmouth, Portsmouth South East Hants, ICP and the ICS, looking to explain and refine our own operating model, both currently and coming into the new system under the white paper. We're looking to refine that. We're looking to give expression to our aspirations and our determination to improve health outcomes for our population. And we're doing that both in terms of the prospect of a transition period before the legislation changes and how we will operate post that legislative change. And I think Linda referred earlier to the publication of the white paper earlier this year. So we're looking at our interface with all those different bits of the system. Some of those themselves are also in the process of changing. So at times it's a little bit like nailing jelly to the wall, but we are getting there. I think it will be a very useful document both for ourselves and for our partners, so that they can clearly see not only how we operate, but also what we believe in and why we show the determination that we do. I have to say that I think, albeit only in draft, I think the work demonstrates that as a CCG here in Portsmouth, we're in a very strong position and have been for some time, pressing really on the objectives that are now finding expression in the white paper, particularly in terms of broader and deeper integration across health and social care, but also with a focus on engaging and supporting the community at place. And the white paper does refer to place as most generally referring to that around the local authority boundary, which for us is the city of Portsmouth, where we fortunately share a boundary. So I think that we'll continue with that work. I hope, board, that you will find that a helpful document. I'm sure that it will evolve over time, but I think particularly given that there is so much change going on in the system, it's really important that we are able to give expression to what we stand for, how we will engage, and our enthusiasm for engaging on those broader geographies and broader agendas across the Hampshire and Isle of Wight system. Our efforts in doing this have been well received. We've had a lot of encouragement from partners. They have found what they've seen to date to be very useful, and we're working closely with them to further refine that. So I'm very happy to answer any questions. I thought Linda referred earlier to the work that PwC have been doing. I know that's only in draft at this stage, but I thought it was very encouraging that they had identified the huge commitment that this board shows to working on those broader geographies as well as within our own city. Thank you.
Thank you, David. The update is noted. Questions and comments? Karen.
I just wanted to know, you may have said it, Dave, sorry, if we knew when the board could see a copy of the document, when the document would be final.
Well, I think, yeah, that will be a decision for the board, I guess, but we will get a revised draft out to you very shortly. We're working on it at the moment, Karen.
Okay, thank you.
Thanks, Karen. Dave Scarborough.
Thank you, Chair. My question is really, when we've discussed this type of thing before, from sitting in a primary care on the ground. I think what's been really important throughout the COVID pandemic is where we found the commissioning support to be as we've worked through it. I think what I'm keen to understand is what that will look like at the end of the transition. And I appreciate, there is a lot of change going on, but when can we realistically expect to be able to see what that structure will look like and where that support will continue to sit?
I guess, Dave, that a lot of that will depend on what we actually see initially in the bill that follows on from the white paper, and how in each system the encouragement from the white paper to delegate significantly to place, both in terms of budget but also in terms of focus on local communities and finding solutions that meet local needs, how exactly that is translated. Now, I think that we have a really good opportunity to shape that for ourselves, and I think we should take on that opportunity fully, and that's one of the reasons why we're so keen to be engaging both at the ICS level and also with the Portsmouth South East Hants ICP.
Thank you. Just as a follow-up to that, I think this may be in the draft when it comes out. Would there be an initial, I think the word I'm looking for is transitional structure from the CCG and the City Council? And I'll use the example of where individual directors are going to sit. We have had a couple of gaps recently in the current structure, and it's really what that structure will look like as we transit through the next year.
Yeah, we're in the process of filling those gaps, and actually we're encouraged to do so by the PwC report. Actually, in terms of the interface between what will be two CCGs across Hampshire and Isle of Wight, we've just seen published the board membership of the new Hampshire, Southampton, Isle of Wight CCG, and clearly our own CCG. It's proposed that there will be a strategic commissioning board that will be made up of representatives of both of those two CCGs. Clearly, it's envisaged that we will share an accountable officer. So I think, Dave, that we will get good representation on that board, but until its terms of reference are established and we know what those agendas are going to look like, it's difficult to say precisely who will be on that board. But I think we're in a strong position. I think we're covering well the sort of sad gaps that we've got at the moment, but we've got a strong team, and I'm very confident that we will be able to play a very, very full part, and we'll be able to continue to improve services for our residents.
Thank you.
Thank you, David. Jackie.
Thank you. Sorry, I was having trouble unmuting. I fully endorse what David's just said. My kind of feelings around some of it is that I think it's really important, however this comes out, that we keep our staff and public engaged and on board and understanding what we're doing, and that if they have every opportunity to work or whatever position there is across the three or systems or tiers, and are with us and understand. That's it.
Thank you, Jackie.
Thank you, Jackie.
Margaret.
You're on mute, Margaret.
Margaret, you're on mute.
Oh, it's doing that. I'm just checking that as the paper or the document that you're working on for Health and Care Portsmouth continues, are you expecting to be much clearer about how the ICS and the ICP see what their expectations are of those particular partnerships vis-a-vis Portsmouth?
Yeah, we're certainly hoping so, Margaret, and I think part of the dialogue that we're having both with the ICP and with the ICS is helping us articulate that. But as I think is inferred in your question, it's a two-way street, and we need some clarity from those other parts to help us understand how best we fit in, as well as them asking us for clarity about how we're going to engage. And I think that that's in a way that's the beauty of the dynamic that we've got going on at the moment. And I think just picking up on Jackie's point about the focus and emphasis for our residents, I think one of the benefits of us trying to codify this in a document, and it always is more difficult when you try to write it down or draw it out, but it could be quite easy for the public to think that the creating a statutory thing across the whole of Hampshire and the Isle of Wight is an odd way of setting about greater devolution. And I think we need to be able to demonstrate to our residents how their voice will be heard, and a focus, as I said earlier, about place and about solutions that fit the place that we're serving, can actually find support in that bigger system, and that's really what we're looking at.
Thank you, David. Linda.
Yeah, so mine's really going back to what Dave said about the support for primary care. I think we have done some good work through COVID in making sure primary care is heard, and we definitely don't want to go backwards from that. We'd like to build on that. I think the other point is we have quite a lot of voices now for primary care. If you think about the PCN clinical directors, we've got the PPCA directors, we've got ourselves as clinical executives, and what we need to work on is how are we going to galvanise those voices, and how are we going to represent ourselves across the various levels to make sure our voice is loud and heard, but we're not all having to traipse to the same meeting. So that is a piece of work that needs to happen.
Thank you, Linda. Okay, anything else? Anybody else? Comment or otherwise? No? Good. David, thank you very much for the
Pleasure,
updates.
thank you.
Okay, item 7 then brings us on to the finance and performance reports. We'll start with 7A, which is the finance report for N10, I believe. Yep, month 10. So, Michelle.
Yeah, thank you, Chair. So in front of you have seen the month 10 finance statements. In terms of order of my reports, I'd like to do the finance report, then the performance report, and then we'll talk about the future-looking reports, if that's okay with everybody. So if we do the finance paper, as I say, month 10, we were on track to achieve the forecasted surplus position. And I can confirm that we have closed down month 11 and we remain on track to achieve the £3.3 million surplus position. The CCG has received its retrospective top-ups for the hospital discharge programme, and we've also got some prospective allocation for that of 80% of expected costs. So from a point of view of certainty, we've got a little bit more certainty now around us actually achieving the £3.3 million surplus position. We continue to work with our colleagues at Portsmouth City Council to make sure that the hospital discharge programme is represented correctly in our claims that we make, and in particular because that changes our expenditure profiles across our normal budget position. So continuing healthcare, for example, you'll see as an underspend in our books currently, but that's because quite a number of our normal patients are sat within the hospital discharge programme. And I also just wanted to say that, you know, the team have worked really hard over the last year to keep on top of all the changes that we've had to grapple with in the finance world, but also on top of that, managing the cash position because we had to try and pay our suppliers more quickly, and we've done really well in that arena, and also just to manage our cash balance to its usual postage stamp status by the end of March, and I'm pleased to say that we're on track to achieve that as well. Yeah, I don't think I'm going to say much.
Graham?
Thanks, Michelle. I think you may have answered this in the outline, but on the more detailed breakdown, I see that mental health commissioning is actually underspent, where I was expecting it to be overspent. Is that because we've got quite a lot of money that's going to come through, expenditure that's going to come through later that you prepared for? Or?
I think that's also partly to do with the hospital discharge programme as well, Graham. So a number of those clients have gone through the hospital discharge programme process, and therefore our normal expenditure rates are skewed this year as a result of that. It's going to be really difficult to try and compare year on year when we get to that position. But yeah, we're really mindful of making sure we understand the patient flows, and equally just so that people are aware that the teams are trying to make sure that those patients, although they're on that hospital discharge programme, they're getting the right care at the right time and then moving on from that position as well into the care that they should be receiving. So we've got one eye on the fact that that hospital discharge programme will stop at some point. Our understanding is it's still going to stop on the 31st of March with a 6-week lag. So we just need to make sure that we're aware of that, because that expenditure then changes when patients or clients end up in services that they require on an ongoing basis. So yes, Graham, it is related to the hospital discharge programme and that slight change of focus for this financial year.
Thank you.
Alison.
Thanks, Andy. Michelle, at our January meeting, we discussed the need to establish a process for considering applications for investment.
Yeah.
We looked in principle at one around integrated children's nursing.
Mm-hmm.
Is there any update on how and when those investment proposals, which are about the sort of long-term resilience of the whole systems, in fact that one is very much a Portsmouth and South East Hampshire proposal, how those are going to be decided?
So can we talk about that when we talk about 21-22 papers rather than the finance? Because
sure. Sorry.
A specific answer to you, but it'll just help in terms of where we are and what the next.
Of course. Yeah, of course.
Yeah, brilliant. Thanks, Alison.
Okay, thank you, Michelle. Is that everything for the financial report to the table. So we're asked to accept the report. We have to do that as a board. We are. That's great. Thank you. Okay, 7B then, Michelle, financial framework.
Actually, if I may, Chair, can I do a normal sort of performance report?
Yes. Yeah.
That's sort of like a here and now as well, isn't it?
Yeah.
And then
thank you.
I'll put the other two papers together because
Okay.
they go hand in hand, really.
Right. So 7C.
So yeah, so if I just do my normal sort of brief update in terms of where we are on performance. As we've been reporting, we continue to report against the national standards set in terms of our performance indicators, and you'll see that the report actually shows a good achievement against those national standards, despite us being in a pandemic situation. So it's good to see that still continuing as the months go by as well. Jackie, you asked the question at the last board about the comparison for 111, and I'm not entirely sure we answered the question within the report. But what the report was trying to show last time round was a comparison month on month. It was a change between 1 month to the next, and I think it was really to highlight the fact that it's really difficult for the service at this moment in time to predict what activity they're going to see, and therefore it becomes really difficult to predict how much service to put on in terms of responding to that demand. So hopefully that sort of helps in understanding, and also in our understanding then for the response times and trying to understand how the service is responding to that fluctuation. Sometimes they get it right and sometimes it's more difficult, I think, as we go through the period. But also key with the 111 call service, because we're doing the 111 first expansion, aren't we? So we are really all over that in terms of making sure that the response times are appropriate and that it dovetails into our emergency response too. So I just wanted to highlight that the covering sheet mentions 111 call answering times, the elective performance indicators, referral to treatment, and in particular the 52-week waits and diagnostic patients as well. And in terms of national cancer targets, I just also wanted to add to the paper that's in front of you to say that it looks like compared to national mean, we're doing really well in our patch as well, and I'll try and make sure that that's updated in the next board paper so that we can all understand that we know that we have been trying to continue with the cancer standards as best we can, and the report certainly indicates that we're doing quite well. But we're also doing quite well if you were then to look at it from a national perspective. I'm going to stop talking there and take questions if that's okay.
Thank you, Michelle. Any questions or comment? Jackie?
Thank you, Michelle, for answering me on the 111. That was really helpful. Because the other big one that I think stands out in the performance is, of course, just RTT. And it's hard to see how we get that back on track. I don't know what the plans are. I don't know how it's beginning. Have you got any sense of when that could be remotely where it needs to be?
I would struggle to answer that in its entirety, Jackie, other than I know that the teams are trying to turn their attention to switching back on as much elective activity as they can. Where they can, because of the issues around COVID patients certainly within PHU. I'm glad that Jo's put her hand up. Hopefully she'll be able to help me a little bit more as well. And we're also still awaiting some update in terms of the national money that's being set aside for RTT recovery going forward. So as I say, we're all over it. I'm going to then turn to Jo in order to hopefully answer that question a little bit more fully.
Thanks. Yeah, I'll try. Again, I think as you said, Michelle, I think from the first wave, we did quite a lot of work, both as a local system at the ICP, but feeding into Hampshire and the Isle of Wight around our recovery plans and how we could get those back on track. Obviously, then we had the second wave of over the winter and saw much more of an impact on health services, and particularly have to recognise PHU, as we've seen, had much higher COVID patients in the hospital than perhaps some other areas. So that will has impacted both on our ability to deliver that wave one plan, if you like, around recovery, but also in terms of how we can then get that back on track. So some of those backlogs will have increased because we had to stand down elective provision over the winter. So I think the recovery planning this time will be led by the Incident Control Centre across Hampshire and the Isle of Wight to get us out of the pandemic response. I think everyone is very mindful that we need to think about the workforce and the toll this has taken on the workforce, and again particularly for us in Portsmouth, where we've seen those higher rates than perhaps other areas in Hampshire and the Isle of Wight. That is going to impact on our capacity to get back up and running as quickly as maybe we would have expected to, but also we have to keep thinking about what's that infection rate and the rate of hospitalisations, because that will continue to impact. So that said, I think the recovery will need to be planned really carefully, again across Hampshire and the Isle of Wight. And we also need to think about how we continue to use some of the independent sector capacity as well. And again, at a regional and national basis, how we work those contracts in a much more aligned way that support the acutes to get that recovery on track, and also looking at alternatives and different pathways. And we were doing a lot of that anyway already in Portsmouth. We're one of the leading areas for advice and guidance that has really improved, making sure people only get referred to hospital when they need to, and also now starting to think about, can we use that methodology as well, or something similar around follow-up appointments as well. So, that we're managing demand in a better way, so that we've really got the right pathways in place to support GPs and patients.
Thank you ever so much. Appreciated.
Thank you, Jo. Graham, question.
Thanks, Andy. Appreciate, Michelle, what you said, that you bring some information into a future meeting which would be a bit more detailed around cancer. So if you want to defer this question to then, I will understand it. But I just wanted to check that, obviously really pleasing to see the cancer performance, but I just wondered, is that off the back of a generally lower rate of referral than compared to pre-pandemic, or is it a relatively similar level?
Very good question, Graham, and I will defer to answer it, because I would be guessing if I was to try, other than to say that we're still achieving higher than the national mean. So I think we're, in terms of still making sure that we're focusing in on the right patients, I think it's worthwhile saying that, and that people are being treated, within those nationally set targets. So I think it's a good thing. But I will go back and ask that specific question, because I think it's a very pertinent question.
Yeah, thank you.
Thanks, Graham. Linda.
I just wanted to mention that obviously if people are waiting a long time, there is a lot of work goes on to make sure they're clinically safe to do so. I think that's really important just to mention. So it's not just about how long somebody's been on a list, it's about the appropriateness of that wait and the urgency.
Thank you, Linda. That's helpful to know. Okay, are there any other items then for the performance report? So can we accept the contents of the performance report, board? Good, thank you. Okay, Michelle, back to you.
Lovely, thank you. Yes, I'll take the other two papers together, because like I said earlier, they sort of are hand in hand. So one is focused on the financial framework, and the other is around the planning that goes behind making sure that we are able to complete that financial framework. So if we take it in that vein, hopefully it will make more sense. So both papers are really a point in time. It's sort of like where we've got to, what we are expecting to happen, whilst we wait for national guidance to be issued. We're still awaiting further national guidance, and I'm told that might be towards the end of March, but I don't yet know if that is going to be coming our way. And at the time of writing the report, the expectation was that at least for the first 3 months of 21-22, we'd still be in the financial regime that we've been in for 2021, with the exception of the hospital discharge programme. So I already outlined that we're expecting that to stop currently. That might change, but that's where we are at this moment in time. What we're also hearing is that the 3-month approach may well be extended into a half-year approach, but I have no confirmation of that as yet. So we are awaiting the guidance. As I said as well about the hospital discharge programme, we continue to work with our council colleagues just to make sure that we're treating patients appropriately through that system so that people don't get stuck, which we have seen in the past. So that's all very good news. And we're still awaiting further guidance around the extra monies on mental health and elective. So it would be really, really good to understand what the expectations are around those two areas so that we can get on with recovery and the additional activity if or as required. So both papers got a timeline in it. Timelines of what work we're expecting to do whilst we wait for the national guidance, and our teams are working on business cases, as we've heard from Alison, and we took some business cases, didn't we, into our conversation at the last board, and also the ICP has been working on discharge to assess business cases, as well as the 111 First and the TRUE programme. So, you know, all of those pieces of work need to form part of our financial framework going forward. And in terms of how are we doing with our forecasting and looking forward, if we look at what we're expecting to spend compared to our previously published allocation, we would be in the realms of needing to look for about £8 million worth of efficiencies, which is probably where we would have been in previous years as well. So there's no surprise there. I think probably as far as I can go in terms of the papers themselves. They're here as this is what we're doing. This is how we think we'll be able to take things forward. But until we understand the financial regime going forward, it's quite difficult to tell you anything further with any certainty.
Thank you, Michelle. There's a couple of questions. Carsten, over to you.
Just a query. These £8 million efficiencies, is that an anomaly, or is that something that's come up in recent times? And of course, is this something that would hamper or jeopardize our recovery? I mean, some of the stuff that we've already paid for activities that the hospital hasn't provided, and how do we now recoup that, or how do we now get efficiencies and recovery without having to spend extra? And this is something that always comes up, isn't it? The pot isn't endless, but we need to get those people who should have been doing the work, and obviously they couldn't. I understand that, to now sort of figure out ways of doing it, because I mean often it sort of lands back in primary care, and this is sort of I slightly worry about that.
Okay, thank you, Carsten. So in terms of a financial framework, having to find some efficiencies is not a new phenomenon. Can't even say that word. It's not new to us. And the way that we need to approach that is by having other initiatives that would mean that because basically what you say is if we're going to keep doing the same, we'll have an £8 million problem, and then we need to say, well, we know we're going to end up with an £8 million. How do we avoid that level of growth, etc.? So that's the sort of next stage that we need to go through, and part of that's already, is already there. The answers are probably already there, given that we've done so much work on the discharge to assess programme, we've done so much on the TRUE programme, etc. It's all about. So if we spend a little bit more there, we should make some savings here, and therefore we don't need to set aside quite so much money. Let's give an example to Portsmouth hospitals, because actually we're going to do it on discharge to assess programme, and therefore they won't need to see as many patients. Yeah, so that's the sort of next step that we need to make sure that we have with the business cases, and part of the conversation we were having last time around some of the ones that came forward at the governing board last in January.
Thank you, Michelle. Linda.
Yeah, so I suppose if there's a level of uncertainty, do we as a board need to have a conversation about going at risk on some of these items? So if we think the business cases are good and sound, and we think for Portsmouth it's the right thing to do, does the conversation have to shift to saying, OK, well, we're going to go at risk to do these because they're so important, and we'll have to sort out the finances once we know more clarity? I know it's a risky thing, Michelle, but yeah, that's just my thoughts.
And a very good question, Linda. So open to debate. I mean, it's not like we don't know about these things, is it? And we are in a very strange financial regime. And I would suggest maybe if we were to go down that route, as long as we're clear about what we're making a decision on going forward, that doesn't run away with us, we could probably be in that position. If it was the right, if we all agree it was the right thing to do, because we think it is the next step that we need to take.
Thank you, Michelle. David.
Yeah, Michelle, I mean, without us ending up on a very well-worn naughty step, I mean, I am concerned about the delay, because it's delay to us improving services for our local residents. And I do, is there any route that we can at least voice our frustration with this? Because it's Portsmouth residents who are suffering as a consequence. You mentioned the schemes that we had put to board earlier in the year. We've got schemes that have been, developed over a significant period of time, for which there's both great support but also great demonstration of positive outcomes for those most in need in the city. And it does seem as if we've been waiting an awful long time for things to get straightened out.
Agreed, David. I think some of this is in our gift to go at risk on, because we have been waiting a long period of time for guidance, haven't we? And we wouldn't ordinarily be in this position. I mean, we've had guidance late, but not this late previously. But we understand why it's happened. It is very frustrating. And of course we are trying to learn from the process that we've been through as well, haven't we? So as long as we're taking that approach with everything, and that it's clear that things still need to come into a committee before it goes, or a board before it gets approved, then that is a decision the board could make.
Yeah, I mean, I think we should visit that very seriously. I mean, we are quite rightly being implored to address the inequalities and the impacts of COVID, and we're being implored to get on with recovery measures, and that's not just about recovery within the NHS's systems, it's also recovery within our communities. And yet, we appear to be being held up in that endeavour, and I think that is a huge shame and a disservice to our communities.
Thank you, David. Alison.
Oh, you're on mute, Alison.
So sorry. I guess I'd just like to endorse what David's saying, really, and just say specifically in the context of the proposals for children's community nursing, what we've got is a coherent set of proposals for the whole Portsmouth and South East Hampshire patch. So, this isn't something where Portsmouth is trying to strike out on its own. It's a coherent thing done on the hospital footprint, and indeed it's a piece of system design which is designed to make the whole system resilient. So actually it's the kind of thing which at an ICS level should be sponsored, mandated, promoted, or whatever. This is the kind of development that we need to see from a forward-looking ICS. So they should be, your colleagues in the ICS team should be requiring us to do this, in my view. So I just wonder whether there's an opportunity, if we were running at risk, to really make that clear to colleagues that this is something where we think we need to set the example rather than declare UDI.
And if I recall correctly, Alison, we did say that the cases that came were all laudable and backed by the board. So if the board wants to say yes, let's get on with it, I think we have the ability to do that. It's just that if we do that, it might mean that something else that might be as laudable comes along in 2 months' time.
I completely understand, which is why there needs to be some process, I guess, of fair and transparent consideration of these cases. But the one for children's nursing is complicated by the fact that it would be so much better if the Hampshire Partnership CCGs were also agreeing, but they're in a similar situation of saying this is all really good stuff, but we can't take a decision yet.
Yeah.
So there's something for me about how do we advocate for a bit of running at risk on a wider footprint than just Portsmouth.
Okay.
Thank you, Alison. Michelle, is there anything else you wish to?
No, other than
So I couldn't quite hear you there. So is that B and D you completed the reports on?
Yes, yeah, I wrapped both reports in together.
That's good. Yeah. As suggested.
When you read them, there, hopefully you'll see that there are similarities. It's just like I say, one's about the financial framework, and the other is about the planning bits that make up that jigsaw.
Yeah. Okay. Thank you, Jackie.
And so, sorry, Andy, just to say that that planning timetable isn't just about Portsmouth. It's about how we're interacting with the Portsmouth and South East Hampshire in particular, so that we're doing our planning in tandem. So yeah.
That's good. Jackie, you had a question.
Yeah, it was to pick up and try and clarify. I understood exactly what Alison was saying, and also what you were saying, Michelle, is that we could run at risk with both of these two projects. So what I'm trying to get my head around is, what's the next step for those two projects? Do we as a board go, yes, we want to go ahead with it? What are we waiting for that stops us moving forward?
I think, Andy, if you're content with the response to that, so I think where I am is, if we as a board are saying these are the next, they're definitely things that we need to go ahead with, and I'm going to widen that out probably to the discharge to assess programme and the 111 first. There are a couple of other little ones that now have escaped my head, other than Alison's children's one that she's mentioned. If those are the ones that we definitely know that all it needs is for us to go, we need to be getting on with this and we need to go at risk, then as long as the board is content that approach, and we will try and ensure that we keep the financials as tight as we can around that. Noting that a number of these things are already up and running. So if you think about a discharge to assess programme, because of COVID, we've got quite a lot of that open already, and it's about we need to make sure it keeps going whilst we add to it. So if the board wants to delegate that back out to the teams to get on with those those things that have already been presented, then we can make that happen. I'm choosing my words carefully to make sure I don't go, hey, we can go off and spend as much money as we want. But we need
I hear you.
Within a controlled framework, because we have got business cases that are all but in them, and we know that it's the direction of travel we want to go in, but we just haven't got that final hurdle of let's get on with them.
Okay.
So is that something we can do? I don't know, is this an extra meeting for the board to just go, yes, is there anything else that we want to look at? Go, or can we make the decision now? I don't want to put anyone on the spot. I'm just trying to see a way. Thank you.
Okay. So it's about identifying a roadmap effectively in terms of users and some next steps.
Sorry, Andy,
Linda.
I was just going to come. Yeah, so I suppose the issue is back to what we were just saying about the other board. For some of these papers, we all have to jump or it wouldn't work. So for the Portsmouth South East Centre Children's Specialist Nursing Service, we might be happy to go at risk, but I suppose unless our counterparts are as well, Alison, I don't know if you could do that change.
There's a variant. There is a variant that's possible that's Portsmouth only. It's just that we don't really want to put the hospital in the position of checking children's postcodes and the service operating differently. So that's why I think it's really helpful if we can, if this board were to say, actually, this is the right thing to do, we should be doing it, then that view perhaps could be carried into the ICP decision-making executive to try and push this and say, go on, let's make this happen, and involve ICS colleagues as well, and saying actually you should be requiring the same level of detailed development of an integrated, more flexible approach to children's nursing across the whole of Hampshire and the Isle of Wight. We know we've got a demography we need to serve here of increased numbers of children with complex care needs. We need to have a good model. A lot of work's gone into this, so that's why I'm saying it's like setting the example, blazing the trail. But it would be much more helpful from the hospital if it could be done on a Portsmouth and South East Hampshire footprint.
Absolutely, and I think they're really good examples of where we're all in the same hiatus, aren't we? So Fareham and Gosport South Eastern and the new CCG are also struggling with. We all know that these are probably as good as ideas as we've got to progress. However, we still don't have the financial regime that's sort of given us the certainty to get on with it.
David, did you come in?
Well, sorry to have another bite at this, Chair, but Michelle, I guess a lot of this depends on how confident you are that all the green lights will be in place with the national systems by the time of our next board meeting. I think if you're not confident that we can get everything through, then I would suggest that we do, within parameters, delegate from the board to make progress, as much progress as we can with our partners, and accepting that there is a certain amount of risk associated to that. But otherwise, we just end up in status, don't we?
I agree, David. Yeah, I would have liked to have been able to come and say, yeah, we can get on and do this, and this. But if we're all content to go at risk, then I think we can make that happen.
Thank you, Graham.
Thanks, Andy. I think mine's just a hybrid version, really, of what David was suggesting, so that we don't get caught in a static, and appreciating next board meeting isn't till May, as to whether we could if colleagues were happy, devote a portion of the development session in April to this, and perhaps bring, so that we're looking at it holistically and not picking off individual pieces, bring those projects that we've agreed but which are holding on finance, and have a sort of risk framework by which we want to either press a green light or we want to continue to hold.
Yeah, that's helpful. Now, I suppose the other thing for the board to be cognizant of is that my understanding of all the ones we've seen are not just Portsmouth specific ones. They are Portsmouth and South East Hampshire wide approaches as well. So it's not something that we're trying to do in isolation. There, I think absolutely all of them, I think we're doing in unison. Yeah, because it's the right thing to do.
Thank you. Alison?
Just a quick point, to the extent that we're looking at schemes in competition, as it were, it'd be really helpful if there's a common framework. I think David has put that point in the chat, but as it's a public meeting in public, it's really worth just articulating that. It's quite an important principle, isn't it, that we look at this, the schemes against a common set of criteria.
Yeah, it's a good point, Alison. Thank you. Okay. Anything else from anybody? No? Okay, so for the purposes of the minutes, so the financial framework and the planning approach, do we agree to accept the content of the reports?
Yeah.
Thank you. I'm getting nods there. That's good. Great. Okay. Thank you, Michelle. That now brings us then on to item 8, quality and safeguarding updates. Karen, over to you.
Thank you, Chair. Yeah, you've got a report of sorts in that we certainly had a capacity issue within the quality and safety team. Last month we didn't receive a report at all, so this is at least something. The Quality and Safety Committee did meet today, so I can update some of the things that are within the report. PHU, they remain under significant pressure, as we know, although this is a constantly changing picture. We've got 4 risks aligned with PHU that haven't been refreshed for some time, quality risks that is, that we're going to need to look at. One of those, the first one is delays in assessment and treatment of planned care that we're all aware of. As we saw from the performance report, the cancer weights are looking good, but there's obviously a lot of work to do around other weights. But I guess what as we were saying, that will be addressed with the sort of regional recovery plan, but we'll need to look at that in terms of the risks, quality risks for that. The second one was around the emergency department and urgent care pathway. That still exists as a risk from quality perspective, although we're hoping, but we haven't got the work, that the 111 First project will start to have a positive impact. There was a risk around safeguarding, but the safeguarding team at PHU is now fully staffed, so that's something we're hoping that can come off the list. And there was an issue around governance. We have got an emerging risk, well, we think we've got an emerging risk relating to a number of SIs within maternity services that the quality team are reviewing to see if there is actually a risk. But there is some level of reassurance because they are starting an operational maternity surveillance group in April, which will start to pull things together more systematically. And there's a new director and deputy director of maternity starting at PHU. So whilst we think there's a risk, we think that there may be some mitigation in place that will help to support some of that. With regards to Solent, there's quite a lot of detail in the report, but just to say, it's noted that there's increased demand, especially around for children and families. The quality team acknowledge that there's increased demand, but what we're aware of is that there's also been increased investment for CAMS liaison services from winter pressure monies, and also investment to support the neurodiversity waiting list. So we're hoping that this will start to have an impact on the demand. So the quality team will continue to review that. With regards to SCAS, they're continuing to meet fortnightly with CCG, and they've moved to REAP level 1, which is a steady state last week, so that's looking positive at the moment. PPCA, just to say that they've increased their numbers. It says in the report 51 patients on the COVID at home service. That's now 138, I think. So that's looking that's quite active and positive. And with regards to the care homes, they now only have 4 care homes with COVID outbreaks, and 3 of those are coming to the end. So that's a much better position. The issue for care homes, I think their current concern is that whilst we went through COVID, all of the care homes went onto NHS Mail, which for us was really positive because it meant the transfer of confidential information, but also to do with POX medication ordering. So that's something that we want them to continue. But I think there's a need for them to do a sort of IG toolkit by the end of June. And so a lot of the home keep, that's quite an extensive piece of work and requires quite a lot of resources that I don't think the care homes feel very confident to undertake. So we need to look at a way in which we can support the care homes to do this toolkit so that they can retain the NHS Mail beyond June, I think. So that's quite an issue for care homes at the moment. And finally, safeguarding. Within the CCG, we've just recruited another safeguarding into another safeguarding post, which is positive because that's been vacant for some time. They've started. And Portsmouth are about to introduce a harmful practice strategic group, which will bring together the FGM group and other sort of honour-based things into one group, and that's going to be chaired by the CCG's Director of Quality and Safeguarding. I think that's all I have to say in addition to what was in the report.
Karen, thank you very much for that. It's very comprehensive and up to date. Questions, comments from members? Graham?
Thanks, Andy. Thanks, Karen. Karen, on page 3 in safeguarding, I know it refers that there's been unfortunately another homelessness death, and that's going to be considered as part of the thematic review. But it does say that that's awaiting the allocation of an independent author, and I didn't know if that was becoming an issue and if there's anything that, if it is, if there's anything we can do to help with that.
I didn't hear that it was this morning. It didn't get addressed at all this morning at the meeting, so I'm guessing not, but I will check that to see if it is an ongoing issue.
Thank you.
Simon, question.
Hi, Karen.
Hi.
Just on page 4, it mentions the primary practice group. I think they're the Practice Plus group, which is now the rebranding of Care UK. But also, I just wanted to ask if there's any more information on what the situation with the Southampton UTC and who approached who about changing the DOS. Was it PPG that approached us about changing the DOS, or did Southampton CCG approach us about changing the DOS? Just because this will impact 111 first and some of the work we do around that.
I don't know the answer to that. I know that we have been in discussions with them, and I understood that we were saying that there wasn't compelling evidence to go to under 2s. I think we were retaining it at under 1 still. Is that would that ring true?
So.
Yeah, I think that's what Portsmouth are still saying.
Okay, thank you.
Thanks. Jackie.
Hello. Karen, thank you ever so much for this, and I completely endorse if the CCG or whatever want to give support to care homes to fill out the IG toolkit form or assessment, because I know how difficult that is. So whatever we can do, because the benefit of supporting them in that seems like it's quite great.
Yeah.
The other thing that I did note, and you did touch on, was the increased demand on CAMS and the increased demand on mental health services. And my focus with me is young people, and I'm wondering how the digital offer that we give to young people is going, because that should be underpinning some of the CAM stuff so that the weights don't develop. So have we had any feedback?
No, Jackie, we haven't. But I can certainly ask about that. No.
Yes, please, because that's the underpinner. I think that's
Yeah.
the kind of the early intervention stuff that, in theory, should be kind of helping with CAMS. Yeah. And certainly it used to work like that.
Yeah.
And I've tried to access the system myself, and the other tiny little tweak with it is that you have to sign in before you can see anything, and I'm not sure how appealing that is to young people.
Yeah.
So that's my comment. So if I can get some feedback on that, I'd appreciate it.
Okay, that's fine. Yeah.
Someone else. Thank you.
Thank you, Jackie. Alison.
Well, just to comment briefly on that, I don't have figures immediately to hand, but I was given some a couple of weeks ago that were looking quite healthy, actually, that the take-up of COOF, the new digital young people's mental health services, has been good. You know, people are feeling very positive about that as an important underlying preventative measure, exactly as you say, Jackie. But we are also still seeing that increased number of CAMS referrals, which is a national picture and reflects the stresses on young people during lockdown, actually. But if it's helpful, I can certainly ask Anthony Harper to provide some up-to-date figures breakdown of the take-up.
Oh, yes, please. Because I know there's others. Yeah, sorry, Andy.
I think we welcome, Alison. Yeah, it'd be useful to see, given, as you say, the national picture and concerns. Sorry, Jackie.
I was going to say that, and of course, there's other organisations out there doing a very similar thing, and I just wondered how they compare. There's another one out there called The Mix, which is another very accessible digital online system. The difference is you don't have to sign into that. So I wondered if that is part of maybe, I don't know if that affects young people or not, actually. That's just a query, and maybe you'll get an answer when we get feedback. Thank you.
Thanks, Jackie. Okay. Anything else for Karen? No? Okay. So we're asked to note the content of the report, the board, which I think we're doing with nods. So thank you for that. Item 9 then is the Emergency Preparedness, Resilience and Response Annual Report. David.
Yeah, thank you very much. So it's been quite a year for this, obviously, but I think it's another good example of where Portsmouth CCG works closely with its partners across Hampshire and the Isle of Wight in terms of how we deliver our various responsibilities under the Civil Contingencies Act. Clearly, there are going to be a huge number of lessons learned for us, but I think what's really encouraging, and you've got the report before you, is that notwithstanding the huge amount of effort that's gone into the COVID response, we've still managed to undertake a number of exercises, both in terms of other types of contingency, but we've also managed to undertake a number of, I think, very valuable communications exercises as well, which is such a significant part of any public body's response to issues like this. The way in which we're structured around this, I mean, obviously we've got a lot of staff across our agencies who are heavily involved in this, but in terms of the board representation, if you like, Sarah Tiller fulfills that role, including for ourselves. And I know, Chair Andy, you are on one of the independent NEDs associated with that, and clearly the directors of public health are hugely involved in this as well. The report sets out the activity that's been going on through the year. It also draws out some early learning and lessons at section 10 there. There will be a lot more on that, and I know, for example, that the Local Resilience Forum is in the process of designing a debrief programme to make sure that we do record our learnings from our experiences over the last 12 months. You'll see at section 13 in the summary there that Portsmouth CCG remains in its position of having substantial assurance, but we all know that with this sort of thing, it all depends on all the partners being in a strong position and all the partners operating well across boundaries as well. So I think it's, in the circumstances, I think it's a very encouraging report. It's there for the board to note. There are a couple of amended processes that have been highlighted, and they're set out in the paper. But I don't think I have, there's an awful lot in that report, but I don't think I've got anything else particularly to draw out to your attention. But I'm very happy to answer any questions that you've got. Thank you.
Thank you, David. Linda.
So it's a very good report, and thank you for the effort that's gone into writing that. But mine's more about the future. So Sarah Tiller, as you said, was representing ourselves. Obviously, as the new CCG comes online on the 1st of April, do we know what the arrangements are moving forward and whether we are going to be fully part of that or not?
I don't think we do know just yet, Linda, but I think that, we will be, I think it would be good for us to keep in tandem with Sarah and colleagues across Portsmouth South East Hants, and we'll need to engage, obviously with the ICS and the other CCG for that transitional period. But I'm sure that it's not beyond the wit of man, certainly won't beyond the wit of woman, to come up with an effective solution for dealing with this in a collaborative way.
Thank you.
Yeah, thank you, Linda, and thank you for the report, David. I can confirm I saw I think it was the minutes of the LRF executive group meeting, which took place this week, and there is an agenda item for all CCGs to look at the whole picture with regards to CCGs in the NHS across Hampshire and the Isle of Wight. And a piece of work has been commissioned to ensure that they are integrated back into the LRF, as David says, to ensure that connection is maintained. I'd like to also echo David's comments. A very good report, and the amount of hours and hard work, as much as you can plan for an event, as much as you can exercise for an event, when a pandemic comes along, it suddenly takes a lot out of everybody, and very much as it did in this case. But everybody stood firm and did a terrific job across all of the agencies. It really was a good example of interoperability and multi-agency approach to dealing with a significant national and localised issue that was carried out very, very well. And I look forward to seeing what they learned from it and how they can improve. But they did a great job. And that's good to see. Okay, next item then is the full register of interest for all staff. It's basically the register that we can see that has the details of all those, the register of interest that has details of all individuals working for or on behalf of the CCG who sit in a decision-making committee. Includes members, regular attendees, and administrative support. And what we're asked here is to review the attached staff register of interest. And if there are any comments, please raise your hand now. Okay, that's good. So we can accept that as a valid document. So thank you for that. Item 11 then is the minutes of other meeting, and these are for noting. So first are the minutes of the Primary Care Commissioning Committee held on the 26th of November. These meeting minutes have been published and agreed. And the second one are the minutes of the Health and Wellbeing Board held on the 25th of November, which again have been published and agreed. Okay, I'll take us then to the next item, which is the date and time of the next meeting in public. The next governing board meeting will be held in public. It will take place on Wednesday, the 18th of May at 2 p.m. and will again be streamed online via Microsoft Teams for the benefit of all. Before closing, I would like to thank Ines Richins, who's been a valued member of our board covering both PCC and NHS CCG work in his adult care role. He's been wholeheartedly supportive of everything that we do in Portsmouth. He's worked hard to ensure that all the residents, citizens and patients that live in the great city have been well looked after, and I think I can speak on behalf of all of us in thanking him for all his efforts during his time with us. And he really has been a first-class person in helping us all out with anything we ever needed help with, in understanding how things work. And my best wishes, which I'm sure you'll agree, forwarded to him for his good future.
Yeah.
Absolutely.
That now brings the meeting to a close. So I formally thank you all for your attendance. Thank you to all those who've managed to log in and watch. And I'll ask that the meeting streaming be brought to an end so as we can formally close the meeting. Thank you very much.
Thank you, Chairman.
Thank you.
Thank you.
Okay. The recording is stopped. Thank you very much. Thanks
We
all.
had confirmation from Democratic Services that it stopped. Sorry.
I'm just doing that now. One moment, please. Sorry.
Lovely.
Hold on,
Thank
please.
you.
I've got a bar come up on mine.
Sorry, that was my recording, which is the backup, and it's the streaming that we need to confirm that stopped.
Thank you, Jane.